Welcome to TechWire, a conversation about technology, policy, and government in California. My name is Christina Gagne, and today I'm joined by Cruz, the Deputy Director and CIO for the Department of Healthcare Services here in California. Chris, thank you for joining me once again.
Great, it's great to be here. Thank you, Christina.
So you guys have your own announcement today about an app that you put out in the marketplace. Why don't you tell us a little bit about it?
Sure. Actually, it's the California Healthcare Report Card by the Office of the Patient Advocate. The Department of Healthcare Services designed, developed, and built that on behalf of the OPA process. It's a shared service that the department provides for IT functions, and we're really happy to showcase that today. It provides a balanced scorecard for HMOs, PBOs, and also addresses questions about your personal health care providers. So I think it's something that we can appeal to 16 million Californians who have smartphones, and in terms of how they address communication in today's marketplace.
Well, it seems like you guys are meeting the consumer in the right place on mobile devices, and this seems to be just the beginning for you. What's your vision for what the Department of Healthcare Services can do in the mobility space?
Right. Well, Christina, hopefully this is one of many to come. Our vision is to continue to write those. We're trying to standardize on the iOS operating system as well as Google, so we're hoping to be vendor agnostic in terms of our technology solutions. So we're hoping to move forward with a Medi-Cal provider enrollment mobile app next. And so we're looking forward to that as well as other opportunities down the road. You know, our vision is to bring information right to our stakeholders and constituents and advocates to ensure that we're providing information on time, real time, where they can get action immediately.
And what's next? I know that you guys have some things brewing behind the scenes. Anything that you can share with us today?
Sure. We have an enterprise architecture plan that we're developing and getting ready to roll out here in the near future on the 2B of what the department's going to look like in the next 3 to 5 years. You know, it aligns well with our IT strategic plan and our department's strategic plan. And what we hope to do is really lay out that fundamental roadmap for the terms and conditions of the Affordable Care Act and meeting those program integrity issues, meeting issues with the Health Benefits Exchange in Covered California, and syncing up where our eligibility enrollment is so we can bring the best possible services to the people of California that we serve for their health care needs.
And what are some of the challenges that you guys are facing? I know that state by state, the exchange system and the Affordable Care Act pose some huge challenges.
Right.
And obviously you guys have undergone the strategic planning to accompany those challenges. But what are some of those challenges, just so our viewers understand how complex this is?
Sure. Well, you know, I think some of the challenges are actually around the time frames. California has done a great job in getting the exchange rolled up, getting it out, and executing a project. It's just working within those time frames. We're working very hard to meet those initiatives and ensure that we're putting the right time frames together, the right information together to ensure that we're successful. So come January 1, we can have an exchange and eligibility enrollment system that everybody could be proud of here in California.
Well, Chris, thank you for joining me once again.
Sure. Thank you very much, Christina.
And thank you to our audience for joining us once again in a conversation about technology, policy, and government in California.